your body doesn't store all the minerals in your blood.
No.
It could have stores in other, as all these labs are fallible. Like there could be a mistake at the lab. You should always look at it in context with previous.
Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and co-founder of the Kidney Coach and head formulator at Kygenesis. And I have the pleasure of being joined again today by the amazing Lindsey Zerker. Awesome. I'm going to hand it across to you, but why don't you start by telling everybody what minerals are and maybe then start down into the rabbit hole of why we might need them in kidney disease.
Yes. So minerals are kind of part of a category we like to call micronutrients. So we've heard of macronutrients, that's like your protein, your carbohydrates, and your fats. And then we have micronutrients, which encompasses primarily vitamins and minerals. And minerals are found in all different areas of the foods that we eat, and they perform a lot of important functions in our body. They help manage our bone health, our blood pressure, and they are cofactors that help a lot of other reactions in our body work. Like it helps our body convert our macros into energy. They perform a lot of really key functions. And when you're healthy, if you're lower in these minerals, then you can start seeing symptoms of like fatigue or weird sleep cycles or hormone imbalance and things like that. So they're really important for us to feel good. But in kidney disease, there's a lot of things that can cause minerals to be a little bit off because the kidney is our master chemist, which helps ensure that things stay balanced or in homeostasis or whatever specific levels they need to stay. And minerals play a key role with that. So that means the kidney is in charge of a lot of minerals.
How reliable you sort of touched on this, but I want to go back. Yes, a blood test for iron, we can go, that's pretty reliable. But what about magnesium and potassium and phosphorus and calcium, because I know it's not reliable for magnesium. We're beginning to see it's probably not that reliable for phosphorus. So tell me about blood tests. How are you keeping an eye on this sort of stuff? How are you checking in? What do you use as a feedback tool to know what people's blood levels are or where they're at?
Yes. A lot of tests for vitamins or minerals are just really not accurate for a couple of reasons. One is that your body doesn't store all the minerals in your blood.
No.
It could have stores in other places and in other forms as well. And that can make it challenging. So magnesium is a really great example that a lot of times just doing a serum magnesium test, if you check it and it comes back normal, technically you could still be really low in magnesium. It's just, that it's, looking that way in your blood, but maybe your cells still don't have enough. Although a lot of times if the magnesium in the serum is high, that could indicate that you have higher levels of magnesium. But even then, who's to say what's the ideal magnesium for you as an individual, as well as for you as an individual who has kidney disease? Because the studies that have been done are fairly old and pretty small sample size with a really narrow view of what magnesium can do or, what we should be worrying about. So if I suspect somebody has too high or too low something, I guess go back for blood tests, like calcium seems to be reliable-ish. A lot of times, there's the argument about ionized calcium or adjusted calcium. So there's a lot of different opinions on that. So kind of, I think the important thing, especially with calcium, is to look at it as a trend. And that's the thing for any labs that you look at, is to look at a trend, because all these labs are fallible. Like there could be a mistake at the lab, or maybe you ate more calcium than usual the day before, or maybe there was excessive physical activity. That's going to mess with your electrolytes. Like there's a lot of different things that can throw these labs off. So you always want to be looking at lab trends. So regardless of whether magnesium is really reliable as a serum test or not, you should always look at it in context with previous magnesiums. And then with a lot of them, you can look at groups of tests. So I feel like iron is a great example of this. And like calcium is a great example of this, where you want to look at other groups to see what's going on. So for calcium, you want to be looking at phosphorus and vitamin D and parathyroid hormone and even like alkaline phosphatase to get a really good picture of what's going on, because none of these minerals operate in isolation. They're all going to be doing things together. And like with iron, you don't want to just get an iron test. You don't want to just get hemoglobin. You want to see the total iron binding capacity. You want to see the transference saturation. Like you want to see groups of tests to help you get an idea. And then you want to say what's going on symptomatically with, myself or as a provider with the patient, and do their symptoms match up with what I'm seeing in the labs? Because, these are all just little pieces of a puzzle. And so it would be really silly of us to take one or two puzzle pieces and be like, oh, I know exactly what this puzzle's about. Like, you can't do that. So you have to take, what's the diagnosis? What are the symptoms? What are the medications? What are they eating? Like, you want to take all of those pieces, and then you can kind of sort of get a picture, because until the Star Trek technology is invented, we are never going to get the whole entire picture. It's always going to be a best guess. And so the more information we have, the better. So that's kind of when I look and I'm trying to assess, like, mineral wise with my patients, what's going on. I want to look at those trends. I want to look at their symptoms. And then I want to try and get the best test available. So for magnesium, I like to see red blood cell magnesium rather than serum. I don't think there's really any other tests for potassium. And we already know sodium, the amount that you see in your blood test, that's not reflective of your intake most of the time. If it's low, then probably you need to have more. But if it's normal or high, you're probably like dehydrated. I don't know.
Yeah, exactly.
So some of them you can't use lab tests to assess. You have to go off of symptoms. And I think that's a really important thing for healthcare providers to remember, is that our clinical judgment is so valuable, and we can't allow numbers to overshadow that. Clinical judgment is a really key piece. And for patients, like, ask your doctor, ask your dietitian, ask your nurse practitioner, physician assistant, whatever. Ask them about, what is their clinical judgment as far as this, not just what is this, black and white on the page saying. I think that's really important.
So remember to hit like and subscribe. That way you'll get notified anytime we put up a new video. If you have any other topics that you'd like Lindsey to talk about, please put it in the comments below and we will definitely do that. Lindsey, as always, thank you for your time, your knowledge and your wisdom, and I appreciate you.
Thanks so much, Fiona. Thanks for having me.
No worries. Thanks for being part of our community, everyone. We look forward to seeing you next time. Bye.